Hey guys, welcome back to my channel PhysioSaurus. In this today's video, I am going to talk about the ankle sprain. Okay, and these are the things that we are going to discuss in the video. So the first we'll discuss about the grades of ankle sprain, and then we'll talk about the lateral ligament sprain, and then medial ligament sprain, and along with that we'll also talk about the complications. Okay, and then we'll talk about the clinical examination which are relevant to physiotherapy. Okay, and then in the end we'll talk about the injury and the healing process after the ankle sprain. Okay, now let's start the video. So the first thing is grades. So there are three grades of sprain: the first grade, second grade, and the third grade. Okay, so in the first grade of sprain means there is overstretching of ligament. Okay, so when there is overstretching of ligament, there will be no laxity, very minimal pain, and there will be mild swelling around that area. Okay, then there is second grade. Second grade means there is partial tear of the ligament. Okay, so there will be mild to moderate laxity, soft tissue swelling, and also the anterior drawer and the talar tilt tests are slightly positive. Okay, now the third one is complete ligament tear. Okay, in the cases of complete ligament tear, there will be severe swelling and pain, and the anterior drawer and the talar tilt tests are highly positive. Okay, so these are the three grades of sprain. Okay, now the next thing is complications. So ankle sprain can lead to complications such as avulsion fracture, normal fractures, okay, ankle fracture, talar subluxation or dislocation, muscle and tendon sprain, okay, and articular cartilage damage of ankle motis. Now let's talk about the lateral ligament sprain and the medial ligament sprain. Okay, now see, the thing is that we studied about the ankle anatomy. Okay, ankle anatomy along with its ligament in my previous video. So you should watch that previous video. The link I'll just mention it in the description box along with the pinned comment in the comment section. All right. So you should watch that video first to understand how many ligaments are present in the ankle. All right. And where are those ligaments present? Also, we have talked about the basic ankle anatomy. All right, which are obviously relevant to the ankle injuries, ankle fracture, or ankle sprain, whatever. Now, the first thing is lateral ligament sprain. So, ankle joint has two ligament. One is present in the lateral side and one is present in the medial side. Okay. So, lateral ligament sprain is one of the most common sprain that you will see in the ankle. Mechanism of injury is plantar flexion plus inversion. All right. And mostly injured ligament is ATFL. Okay. Then calcaneofibular and then posterior talofibular. So these three ligament are present in the lateral side of the ankle. Okay. And out of which ATFL is the most commonly injured ligament. Clinical features include pain, swelling, tenderness over the affected area, affected ligament, and anterior drawer test is positive. Okay. Now, there are certain conditions which are related to anterior drawer test. If the displacement is more than 8 mm anteriorly, then it suggests anterior TFL ligament laxity. Okay. So if the displacement, when you perform the anterior drawer test, and if the displacement is more than 8 mm, okay, anteriorly, then it suggests that there is laxity of ATFL ligament. Talar test is positive, obviously, and if talar tilt is more than 5 degree, then it suggests laxity of the ATFL and calcaneofibular ligaments. All right, so this is all about the lateral ligament sprain. Now let's talk about the medial ligament sprain. In medial ligament, there is just one ligament, which is deltoid ligament. And again, deltoid ligament has two parts. One is superficial, okay, and one is deep. And that we have discussed in the previous video. Okay, so you can just watch that video. The link is in description box and also in the comment section. Okay, and since the deltoid ligament has two parts, superficial and deep, so we call it deltoid ligament complex. All right. Now, what is this medial ligament sprain? Now, the mechanism of injury will be eversion plus pronation. If there is mild sprain, let's say that medial ligament sprain is mild, then only the superficial part of deltoid ligament is torn. But in severe injury, deep part of ligament deep part of deltoid ligament is torn, leading into lateral talar tilt. And if there is lateral talar tilt, then weight bearing problems it can occur if it is more than 2 mm. Okay. Now, there are two types of treatment protocol which surgeons or orthopedics doctor does. The first one is conservative treatment for mild sprain, and then there is surgical reduction for severe sprain. Conservative treatment and surgical reduction, we these two topics, I have discussed it in previous video where we have talked about the ankle fracture. Okay, ankle fracture. Now, to sum up all the three videos that I have uploaded till now, including this. So basically, if you will talk about the ankle injury, okay, so ankle injury can be divided into two parts. First one is fracture, okay, and the second one is a sprain, okay. So the previous video was on ankle injury, okay, discussing about the types of injury that can occur in the ankle, and we have also discussed the fracture and sprain, not a sprain actually, but just the ankle injury and then the fracture. In the second video, we discussed about the management protocol for the fracture. And in the third video, which is this one, we have discussed about the sprain. And in the fourth video, which is the upcoming video, we will talk about the PT management for sprain. Okay. So this is the conservative treatment and then the surgical reduction. And we have discussed all these two in the previous video. Okay, now let's talk about the examination. Okay, so the first one is palpation of proximal fibula close to the knee to rule out Masoneve fracture. Now, what is this Masoneve fracture? So, Masoneve fracture means fracture of proximal fibula along with the ligament injury and fracture of medial malleolar. So, all three happens at the same time. So, this is a Masoneve fracture. Okay. Now, the second thing is squeeze test to rule out ankle dysmosis. Okay. Now, in the Myasthenia fracture, there is also syndesmotic injury, which can also occur. Okay. So, the third one is external rotation or cotton test to test for syndesmotic injury. Okay. The fourth one is palpation of proximal or the base of fifth metatarsal to rule out avulsion fracture. Okay. From the peroneus brevis pull. Peroneus brevis is actually a muscle. Okay. From the peroneus brevis pull. And then the last one is anterior drawer and inversion stress test. Okay, so we also perform that. Okay, so this is about the examination part. Now let's talk about the injury and the healing process. So there are basically four stages. Okay, first is inflammation or acute stage, then there is subacute stage, and then there is repair or proliferation stage, and then in the end there is remodeling or maturation stage. Let's talk about it one by one. So in acute stage, cardinal signs and symptoms of inflammation are seen, that is pain, edema, erythema, warmth, and decreased function. And it occurs immediately after injury and it lasts for about 3 to 5 days. Then there is subacute phase, which actually begins at about 3 days after the injury and lasts up to 6 weeks. Okay, so subacute phase it lasts up to 6 weeks. There is decreased sign and symptoms of inflammation, that is cardinal sign and symptoms. Okay, and in this phase the tissue repair begins. Okay, so the weak collagen fibers it develop scars at the injured site, and the 7 days after injury collagen increases. Okay, so in this stage only low amount of stress should be applied to the newly forming scar tissue for proper alignment and development of collagen fibers. All right, now the next one is avoid too much stress, as in early stages collagen fibers are weak. Okay, so you don't have to give too much stress. Okay, but low amount of stress should be applied to the newly forming scar tissue for proper alignment and development of collagen fiber. Then the last one is remodeling or maturation stage, which begins 1 week after the injury in grade 1 sprain and approximately 3 weeks after injury and grade 3 sprain. All right. Now the collagen tissues become stronger and more organized in remodeling or maturation phase or stage. All right. By the end of fifth or sixth week, scar tissue tensile strength increases. So basically, the tensile strength of the scar tissue increases by fifth to sixth weak. So you can give more stress. All right. So stress should be given to encourage strength and proper alignment of the tissues. All right. Now the maturation phase can last longer than a year, but patient can return to activity much before that, which is obviously. So this is it. Thank you so much for watching this video. Next video will be about the PT management. Okay. PT management for ankle sprain. All right. So thank you so much guys for watching this video.